So I thought I'd do a little video clip on some of the practicalities around treating clients who are depressed. I think one of the most important things to keep in mind is that depressed clients are depressed. And I know that sounds a little bit silly or a little bit obvious, but the characteristics of depression are such that clients have difficulty with motivation, with organizing themselves, with engaging in activities, tasks, homework assignments. And so some clinicians have a tendency to say, well, they're just not motivated, and start to disengage with the client. But that's really not fair, because the nature of depression is to be poorly motivated. Clients have difficulty setting up appointments, showing up for appointments, following through with activities. So you need to keep in mind that their sort of a lack of sort of commitment, so to speak, to the treatment session is probably a result of the nature of the disorder that they're experiencing. So, you know, sometimes we have a tendency to say that we want to work with clients that are more motivated, but in so doing, we're having a negative bias towards the clients that are actually struggling the most. Some clinicians find it hard to treat clients who are depressed, and this is because they have such low energy. When they come into the session, they're not bringing a lot of dynamic energy to the process. And so you as a clinician have to be the one who brings energy into the room. This is particularly noticeable when you're treating individuals in a group setting. You can have a whole group of people who are all depressed, and they seem very lethargic. And so you as the facilitator need to bring energy into the room. Now, this doesn't mean you need to be all super bubbly or super energetic, because that can be a bit of a turnoff for your clients. But it means you have to work hard to keep conversations going, to get them going, to bring focus to what's going on. One of the difficulties with this is that you also need to be cautious that you don't get depressed yourself. Sometimes when we're listening to the stories of depressed clients, we start to buy into their thinking and their way of looking at the world, and we can start to feel our own mood going down. So it's important to always be able to pull yourself into that more objective position where you can look at the situation and think, how would a healthy individual respond to that kind of difficulty? Depression is often connected to other problems as well. So a person may be having a medical problem such as diabetes or difficulty with sleep. Their depression may be linked to something like substance use. So if you're drinking heavily, alcohol is a depressant and can lower your mood. Seasonal issues are often important, so the amount of sunlight that a client is experiencing may affect their mood. And so paying attention to that type of thing. Pregnancy, birth, perinatal depression are all factors that one may want to pay attention to. One of the things to be particularly mindful of, particularly if you're working with young people kind of in their late teens, early 20s, is the possibility of early psychosis. So an individual may be decreasing in their functioning, may be lethargic, have low motivation, and it may be interpreted that they're depressed. But in reality, this may actually be prodromal symptoms of psychosis, that they're in the beginning stages of going on to having something quite serious like schizophrenia. So it's important to have really good diagnostic skills and be paying attention to all the factors that are going on, and have an open mind to the possibility of early psychosis. With clients that are significantly depressed, your first line of attack is usually around activation. Clients are withdrawing, staying at home, having difficulty getting out of bed, and having just general difficulty engaging in the normal activities of life. And so one of our first steps is we just want to get clients to become more active and start doing more things. It doesn't really matter what kind of activity that they engage in, whether it be re-engaging with an old hobby, making social contact with a friend, or solving some kind of problem that they're having. But as long as they increase their activity level, that's important. Now, sometimes there's critical events that are happening that they're avoiding. Maybe they need to talk to their place of employment so they don't lose their job. So sometimes you need to set goals around like that. But one of the main objectives is to do things that are going to increase their level of pleasure. Now, sometimes at the beginning, nothing they do brings them pleasure, but beginning that sort of kind of routine of starting to do things will help them in the long term. Consider ways to increase the individual's social connections with others. We know that social connection is strongly connected with mood. And you don't need to target developing sort of deep, intense, sort of interpersonal relationships, but just physically being with people. And sometimes that can be as simple as sitting in a chair in a room with other people listening to a talk, or listening to a musician, or attending a church service. Things that just get the individual to be with other people. One thing to consider is the use of groups. Groups can be a particularly useful way to help individuals who are depressed. Firstly, it increases their social contact by simply being in a room with other people. But it also helps normalize their experience of depression so that they know that they're not alone. Now, sometimes we're hesitant to use groups because clients are very severely depressed and they're going to need more personal attention. But there is some research that suggests that even a severely depressed person in a group that's designed for low intensity depression is of benefit to them. So sometimes this can be a good thing to do if you have sort of an issue of waiting lists, or just sort of a beginning point in terms of treatment. Anyways, there's some thoughts on the practicalities around treating individuals who are depressed.